I have the pleasure and privilege to be speaking with a friend, Peter Chen. He is the Director General of the Taipei Economic and Cultural Office in Houston. Welcome, it's good to see you.
Thank you for having me.
As I was preparing for Spotlight on Taiwan, I'm just so impressed with the fact that your numbers of people that have been affected by COVID-19 are just so low. Tell us how you were able to control this pandemic.
Yes, despite the highly infectious manner and also our proximity to the source, I think we are successful to prevent major outbreak. Now we only have 429 cases and 322 already recovered. And we are really happy to say that there are no new cases in 6 straight days.
How many fatalities have there been?
So far, 6.
And your country first realized the danger of this virus very early, in fact, in 2019.
Yes. Yeah, I think that's on December 31st.
31st.
Our CDC noticed on online source that there are 7 atypical pneumonia cases reported in Wuhan.
So tell our audience about how Taiwan has had its position, lost its position, and so forth with the WHO, and particularly the World Health Assembly, which is what, the governing body for WHO?
Yes, I think many people know that Taiwan are unfairly excluded from participate WHO. And I think we has not been invited since 2017 to attend World Health Assembly. And last decade, we has been barred 70% of technical meetings. And also geographically, Taiwan falls in WHO regional region of Western Pacific, but we never have any information from them. So I think that's really unfair to 23 million people in Taiwan.
So one of the things that surprised me is if you had asked me when was Taiwan excluded from the World Health Assembly, I would not have said 2017. I would have guessed many years before that. So what happened in 2017 to create this situation where you then were excluded?
I think Taiwan's participate in WHO is limited, not comprehensive. So it's on and off. And I think 2017 is all due to political reason that we were excluded from WHO.
So when you realized how serious this virus was, every country has addressed it in different ways. Tell us what your country did, what Taiwan did immediately to put some controls and to limit the virus's impact.
Yes, I think just as I mentioned, when we know that some cases happen in Wuhan, we start on-board quarantine for passengers on direct flight from Wuhan. And then we activate Central Epidemic Command Center to coordinate all the efforts to combat the virus. And my president, Tsai Ing-wen, held meetings in National Security Council to integrate and coordinate all efforts from related ministries and agencies, including containment of the spread of the virus, and also financial relief and economic stimulus. We also implement a lot of measures, for example, border quarantine, 14 days home quarantine or isolation, and also mobilization of healthcare system.
What about testing?
Testing, we do a lot of designated testing. First, the first priority will be close contact, and also we do testing for all the risk high-risk groups. For example, like medical personnel or drivers for public transportation. Those are some people that we do the test first.
So, we heard so much, and you've lived now in the United States for a while. You know what Americans feel about having any type of identity card. But in Taiwan, you do carry or have a health identification card. Is that correct?
We have a national health insurance card. So it's like a comprehensive and affordable medical system. So everybody can easily access medical service, including foreign nationals working and studying in Taiwan.
So people they carry this card, but that also means that any health issue that you've had, that's reported into some type of database, isn't it?
That's right. Yeah.
So tell us more about how Taiwan has handled contact tracing, because I think that was one of the major reasons for some of the success that you've had.
Yes. I think it should begin from when people enter Taiwan in the airport. They have to put all their traveling history, contact history, clustering in the mobile phone. And then all the data will go to the authority. And then the authority will provide feedback also by text and to provide care or provide support. And also help them to contain.
And what if I turned off my phone or the battery ran out? What might happen?
Actually, when you enter the airport, there will be like body temperature monitoring, and there's other way. That's some way that we use innovative technology to help contain the virus, but there's other ways to prevent the spread.
Yeah, but I think you didn't quite understand what I was asking. So that if I am out on the streets of Taipei,
yeah,
and I turn off my phone, you're not able to track me. So how would someone then follow and see where I was?
Not much of that kind of cases, because people normally comply the guidelines.
And that is something very interesting and a little bit different about your culture. There has been acceptance and compliance. We just have a little bit more time, and I do want to ask you about something else, and that is, I read that as a preventative measure, it was done so that the price of masks could not be increased. So you don't have the situation that we've experienced here where suddenly the price of a mask, when it should be 75 cents or whatever, it's now $5 to $10 if you can even get one.
Yeah.
You also rationed the mask somewhat. Elaborate on some of these measures that you took and that were so successful.
Yes, I think that's also one of the measures that we took in the early stage, because we learned from our experience before when we deal with SARS in 2003 and H1N1 in 2009. So we know people were very concerned about the availability of masks. So at that time, my government combined the effort of public sector and private sector and requisitioned in total of 73 companies to boost the daily production of the mask. So from the beginning, it's about 2 million daily production, and now it's 16 million daily production of masks. And also we developed a rationing system to allocate masks to every people. So that's the way that to reduce the panic. And also, I think this is also one of the reasons that how we successfully contain the virus, because we provide adequate PPE to people.
And in the beginning, you banned exports of masks, and now you're one of the major providers.
Yeah, because this I think also based on the experience that we know mask is so important to contain the virus, and we have to deal that domestically first. So that's why we ban. And also at the beginning, as I say, the production is not that much. And now we already have sort of like adequate mask for all our nationals. So we are thinking to help other country to combat the virus together. So that's why I think April 1st, my president announced we donate 10 million masks to US, to European unions, and to some country that's seriously hit by the virus. And after that, we also provide some other assistance and some other medical material to other countries.
And you must be having, in a sense, and it's sort of sad that this is the reason, but a sense of pride in your country that what you were able to do has been a model for Israel and New Zealand and other countries.
Yeah, we are so proud of that. And I think that's also because all the people are in this together. They are thinking that we have to collaborate to fight this virus together. So as I say, we have 6 straight days without any new cases. And all the people in Taiwan are so excited because it's an accomplishment achieved by everyone.
And truly, Taiwan has been isolated diplomatically. How many countries do you now have diplomatic relations with, formal diplomatic relations?
We now have 15 countries have formal relationship.
So do you think that the way Taiwan has handled this situation, which has been recognized globally, do you think it will have an impact in any way on Taiwan's isolation?
I think so, yeah, because a lot of countries, for example, we take WHO as an example. A lot of countries already noticed that it's unfair and disadvantage that Taiwan is not part of WHO, so they already take many concrete action to back in Taiwan. And all our diplomatic alliance also receive support and assistance from Taiwan at this tough time. And I think more countries will see the merit that is good to have Taiwan in the international arena to provide experience or provide support for other countries.
Now, I read just a few days ago, our Secretary, Alex Azar, Secretary of Health and Human Resources, had a conversation with your Minister of Health.
Yes.
What resulted from that?
I think it's a concrete and very productive meeting. Yeah, although through telecommunication. Yeah, and I think the Secretary of Health mentioned that United States will cooperate with Taiwan and help begging Taiwan to participate at WHO, and that's we really appreciate, and we hope more countries can come out and correct this unfair and not right things.
Do you think that Taiwan will be a net beneficiary with some of the changes we're seeing in the supply chains?
Yeah, you mean like economy?
Yes.
Yeah, because of the COVID-19 issue, a lot of companies actually suffer. Yeah, especially all those companies has their raw material or market related to China. Yeah, so I think we will see more company thinking to maybe change their supply chain or move out their factory from China.
And we have just another few seconds. Has Taiwan reopened? Are the borders open, or is it still closed? And are people having to maintain social distance, and are restaurants open again?
I think our borders still temporarily closed for foreigners, but our restaurant and all other stores are still open. We don't have a lockdown. People still go to work.
Did you never had a lockdown?
Yeah, we don't have lockdown, and students still go to school. Yeah, but we practice social distancing and maintain good health behavior. When I wash hands.
And where, from my visit to Taiwan over a year ago, I've realized that people wearing masks was part of the culture, and so we need to get used to.
Because I think people, I think because of the density of population in Taiwan, and people always don't want to bother the other people. So in the past, if people have flu, they will wear a mask. One thing is to protect the other people and also protect themselves. It's become a sort of polite culture. Yeah.
Well, I think eventually it'll be the same here. Thanks so much for joining us. And as I mentioned with you, this is Spotlight on Taiwan. We've done Tunisia, Brazil, and Israel. So it's great to have you with us. And clearly, Taiwan has been extremely successful and may continue to be so.
Thank you, Jim. And it's my pleasure to share Taiwan's response to COVID-19 with you.
Thank you.